Teach Me to Help, Module 1, Lesson 1, Definition of Communication Concepts, Forms and Types of Communication. 1. Introduction to Communication. Definition, Importance, and Communication Process. Definition of Communication. Communication is the process of sharing information, ideas, emotions, and skills through the use of symbols, words, sounds, or behaviors. It involves a sender, who encodes and transmits the message, and a receiver, who decodes and interprets the message. This process can occur in various forms such as verbal, nonverbal, written, and visual. The communication process is a dynamic interaction involving several key components. Sender creates the message. Message, information, ideas, thoughts shared by the sender. Medium or channel, means through which the message is transmitted. Receiver, individual to whom the message is directed. Feedback, response from the receiver back to the sender. 2. Types of forms of communication. Types, forms, and barriers. Types of communication. Verbal communication is the use of spoken or written words. Oral communication, face-to-face conversations, phone calls, video conferences, presentations. Written communication, emails, letter, reports, memos, social media posts. Nonverbal communication, use of body language, gestures, facial expressions, eye contact, posture, other physical behaviors to deliver messages. The most known nonverbal ways of communication are kinesics, proxemics, haptics, chronemics, paralanguage, which is the tone, pitch, and volume of one's voice. Forms of communication. Communication can take four forms: intrapersonal, interpersonal, public, and mass communication. Intrapersonal communication. Thoughts, self-talk, internal reflections. Interpersonal communication. Direct, face-to-face between or more people. Public communication. When a person speaks to a large audience, public speaking, university lectures, or media broadcasts. Mass communication. Dissemination of information to a widespread audience through mass media, TV, radio, newspaper, internet. Barriers to effective communication. Barriers to effective communication are obstacles or challenges that hinder the successful exchange of information, ideas, emotions, or skills between individuals or groups. These barriers can manifest in various forms and arise from different sources, impeding the clarity, understanding, and effectiveness of communication. Barriers to effective communication. Physical barriers, noise, distance, poor lighting, technical issues. Psychological barriers, stress, emotions, mental health, lack of empathy. Language barriers, not sharing common language, or different levels of proficiency in a shared language. Jargon, technical language, or complex terminology can create barriers for individuals who are not familiar with specialized vocabulary. Cultural barriers, differences in values, norms, beliefs, communication styles, social customs. Perceptual barriers arise from differences in how individuals perceive and interpret information. Differences in sensory perception, cognitive processing, and biases, or selective attention. To address these barriers, it is essential to consider the specific challenges faced by individuals with disabilities. For example, providing alternative formats for communication materials, example Braille, large print, audio recordings, can help overcome physical and perceptual barriers. Fostering an inclusive environment that values diversity and respects individual differences can help reduce psychological and cultural barriers, promoting clearer and more effective communication. 3. Inclusive communication. Principles and impacts, challenges, stereotypes, and engagement. Principles. Person first language is putting the person before their condition. Say person with a disability rather than disabled person. Avoiding negative or diminishing terms. Using specific and accurate terms. When describing a disability, it's preferable to use specific and accurate terms. Say person with cerebral palsy rather than person with motor issues. This helps avoid generalizations and inaccuracies. Respecting individual preferences. It's important to respect how people with disabilities prefer to be referred to. Cultural and social impacts. The adoption of inclusive language can lead to positive changes in the perception of people with disabilities within society. It promotes acceptance and reduces the stigma associated with disability. Psychological and emotional impacts. Using inclusive language can provide the psychological and emotional well-being of people with disabilities. Feeling respected and recognized as full individuals can boost self-esteem and a sense of belonging. Political and legal impacts. Inclusive language can influence policies and laws. Respectful and accurate language in legal documents and public policies can promote equality and the rights of people with disabilities. This is reflected in anti-discrimination laws and accessibility policies. Examples and challenges. In daily life, using inclusive language means being mindful of the words we choose and how we use them. For example, instead of saying mentally retarded, one should say person with intellectual disability. Media plays a significant role in shaping public perceptions. Using inclusive language in media and advertising can help normalize diversity and promote a more inclusive view of society. For instance, representing people with disabilities in positive and varied roles rather than stereotyped ones. Schools and universities should teach and promote the use of inclusive language to help shape a generation of more aware and respectful individuals. This can be done through awareness and inclusion programs. Despite the clear benefits of inclusive language, challenges and resistance still exist. Some people may be reluctant to change their language for various reasons, including lack of awareness, habit, or disagreement with the concept of inclusive language. It's essential to address these resistances with patience and education, explaining the importance of respectful and inclusive language. Avoiding stereotypes. Stereotypes about disabilities can be harmful and perpetuate misconceptions. One effective approach to avoiding stereotypes is using person-first language, which places the individual before their disability, emphasizing their humanity. For example, saying person with a disability rather than disabled person recognizes that disability is just one aspect of a person's identity. Asking individuals about their preferences and needs rather than making assumptions fosters respectful communication. Steering clear of language that evokes pity or portrays individuals with disability as helpless is essential. Instead, using empowering language that respects their disabilities and contributions promotes a positive image. For instance, rather than saying suffers from, it is more respectful to say lives with or has. Engaging people with disabilities to communicate. Effective engagement involves actively including people with disabilities in conversations and decision-making processes. One way to enhance engagement is by creating accessible content. This includes providing captions for videos, using alt text for images, and ensuring that documents are compatible with screen readers, allowing people with disabilities to participate fully. Providing information in various formats caters to different needs. This might include printed materials, audio recordings, braille, and digital formats accessible on different devices. Promoting inclusive participation involves encouraging people with disabilities to take part in discussions, meetings, and events, ensuring that venues are physically accessible and accommodations such as sign language, interpreters, or assistive listening devices are available. Fostering a culture of respect that values diversity and inclusion encourages open dialogue about disabilities and provides platforms for people with disabilities to share their experiences and perspectives. Using inclusive imagery in marketing materials, websites, and social media ensures that diversity, including people with disabilities, is reflected. Representation matters, and seeing diverse images helps normalize the presence of people with disabilities in all aspects of life. 4. Models and theories of communication. Chomsky, Piaget. Chomsky's LAD, theoretical construct proposed by Chomsky in the 1960s to explain the innate biological ability of humans to acquire language. Language acquisition device is a pre-wired neurological system in the brain that allows children to rapidly learn and understand language during their critical developmental periods. Theory's key points include innate ability. Children are born with an inherent capacity for language acquisition, which is triggered by exposure to spoken language. Universal grammar. Chomsky proposed the idea of a universal grammar, a set of structural rules common to all languages, which the LAD helps children to recognize and apply. Critical period. There is a critical period during early childhood when LAD is most effective, after which language acquisition becomes significantly harder. Piaget's theory of cognitive development. Theory about the nature and development of human intelligence. The theory emphasizes the active role of children in constructing their understanding of the world through interaction with the environment. Cognitive development occurs through a process of assimilation and accommodation. As children progress through these stages, their capacity for understanding and using language becomes more sophisticated. Theory emphasizes the development of cognitive abilities as a foundation for effective communication. His theory is constructed around four stages of cognitive development: sensory motor stage, pre-operational stage, concrete operational stage, formal operational stage. Sensory motor stage, birth to 2 years old. Through senses and actions, develop object permanence, start to understand cause and effect relationships. Pre-operational stage, 2 to 7 years old. More proficient with language and symbolic thought, struggle with logic and understanding concrete reasoning, often exhibit egocentrism. Concrete operational stage, 7 to 11 years old. Logically thinking about concrete events, understandings of conversations, can perform simple logical operations. Formal operational stage, adolescence to adulthood. Abstract thinking skills, logically thinking about abstract concepts, formulating hypotheses, engaging in deductive reasoning. 5. Neurological, developmental, and psychological disorders. Neurological disorders, developmental disorders, and psychological factors affecting communication, hearing, and speech impairments. Neurological disorders affecting communication. Neurological disorders can significantly impact communication abilities by affecting various aspects of language, speech, cognitive function. Neurological disorders: aphasia, dysarthria, apraxia of speech, traumatic brain injury, cognitive impairments such as Alzheimer's and dementia. Aphasia, language disorder, impairs the ability to understand and produce language, affecting speech, writing, reading, comprehension. Expressive, Broca's aphasia, difficulty in speech production, preserved comprehension. Receptive, Wernicke's aphasia, fluent but nonsensical speech and poor comprehension. Dysarthria, motor speech disorder caused by damage to the nerves or muscles involved in speech production. Can result from conditions such as a stroke, brain injury, Parkinson's disease, or multiple sclerosis. Affects the clarity, strength, and coordination of speech movements. Leads to slurred or unintelligible speech. Apraxia of speech impairs the ability to plan and execute the movements necessary for speech. Difficulty initiating speech sound or sequencing sounds correctly. Inconsistent speech errors. Difficulties in sound production and distorted articulation. Traumatic brain injury, depending on the severity and location of the injury, can cause aphasia, dysarthria, cognitive impairments, speech difficulties, changes in social communication skills. Dementia, progressive decline in cognitive function caused by various conditions, such as Alzheimer's disease, vascular dementia, or Lewy body dementia. Word-finding problems can lead to confusion and difficulty understanding complex language. Developmental disorders affecting communication. Developmental disorders can significantly impact communication abilities, affecting various aspects of language, speech, social interaction. Developmental disorders: autism spectrum disorder, specific language impairment, ADHD, specific learning disorders, intellectual disability. Autism spectrum disorder, characterized by deficits in social communication and interaction, as well as restricted interests and repetitive behaviors. Challenges with nonverbal communication, eye contact, gestures, and difficulty in understanding social cues and use of language in social contexts. Delayed language development, echolalia. Specific language impairment, characterized by difficulties with language acquisition despite typical cognitive development and absence of hearing or neurological impairment. Delayed speech and language milestones, limited vocabulary, grammar difficulties, challenges with comprehension and expression. Attention deficit hyperactivity disorder, ADHD, difficulty staying on topic, interrupting others, regulating social interactions, maintaining attention during conversations, following instructions, organizing their thoughts, misunderstanding in both academic and social settings. Specific learning disorders: reading, dyslexia, writing, dysgraphia, mathematics, dyscalculia, can impact language processing, written expression, and comprehension, affecting communication abilities in academic and everyday contexts. Intellectual disability: significant limitation in intellectual functioning and adaptive behavior, which often impact communication abilities. Delayed language development. limited vocabulary, difficulty understanding abstract language concepts, challenges with social communication skills. Psychological factors affecting communication. Psychological factors can significantly impact communication abilities, leading to difficulties in expressing thoughts and emotion, understanding social cues, and engaging in meaningful interactions with others. Individuals affected by these conditions may benefit from psychological interventions or speech language therapy. Psychological factors: anxiety, selective mutism, depression, social phobia, stress. Anxiety disorders: generalized anxiety disorder, GAD, social anxiety disorder, SAD, or panic disorder. Difficulty initiating or maintaining conversations, expressing themselves clearly, or engaging in public speaking due to fear of negative evaluation, embarrassment, or nervousness. The speaker can have a rapid speech, stammering and sweating during conversation. Selective mutism: inability to speak in specific social situations, school, public places, despite being able to speak in other contexts. Children with selective mutism choose not to speak due to extreme shyness, anxiety, or fear of negative consequences. Depression: affect communication by causing feelings, sadness, hopelessness, and low self-esteem. Difficulty expressing themselves, conveying emotions, a monotone voice, limited speech, initiating and sustaining conversations. Social phobia: anxiety disorder characterized by intense fear or avoidance of social situations due to fear or negative evaluation or embarrassment. Extreme anxiety in social settings, leading to avoidance of speaking or interacting with others, blushing, trembling, or difficulty maintaining eye contact. Stress can cause rushed speech, irritability, and difficulty in processing and responding information. Hearing and speech impairments. Hearing impairments, affecting the ability to perceive and process auditory information effectively. Conductive hearing loss, sensorineural hearing loss, and mixed hearing loss. Conductive hearing loss, difficulty hearing speech sounds clearly, especially in noisy environments. Struggle to understand conversations or follow verbal instructions due to reduced clarity and volume of incoming sounds. Sensorineural hearing loss, difficulty discriminating between speech sounds or understanding conversations, particularly in noisy environments. Mixed hearing loss, difficulty hearing speech sounds, understanding conversations, and following verbal instructions. Speech disorders affect the production, articulation, fluency, or quality of speech. Stuttering, apraxia of speech, dysarthria, phonological, articulation, and voice disorders. Stuttering, disruptions in the flow of speech, fluency disorders, such as repetitions, prolongations, or blocks of sounds and syllables. It can cause anxiety about speaking and avoidance of communication. Apraxia of speech, difficulty planning and coordinating the movements needed for speech production, inconsistent speech errors, difficulty initiating or sequencing speech sounds, and challenges with coordinating articulatory movements. Dysarthria. Phonological disorders, consistent patterns of sound substitutions, deletions, or distortions that affect intelligibility. Articulation disorders, difficulty producing speech sounds accurately due to problems with the placement, timing, or coordination of movements of the lips, tongue, palate, or jaw. voice disorders, abnormalities in the quality, pitch, loudness, or resonance of the word that impact communication. 6. Conclusion and key points. Effective communication is vital for fostering meaningful connections, promoting collaboration, and achieving mutual goals in personal, professional, and societal contexts. By understanding the principles, processes, and challenges of communication, individuals can enhance their communication skills and navigate interpersonal interactions more effectively. Thank you for your attention.